Hi, my name is Bryson Roberts, and I am currently a senior at USF. I will graduate with my Bachelor's in Health Sciences in spring of 2019. My career goal is to become a nurse practitioner. What does a nurse practitioner do? A nurse practitioner works with patients directly. They follow a patient-centered model when working. They work with patients of all ages, from young to old. They help manage a patient's overall care. They diagnose and treat patients. And they also fulfill other activities based on the setting that they work in. They have to learn how to work and consult with doctors if they work in a place like a hospital or a doctor's office. And then they also heavily emphasize preventative care and health promotion. The daily duties of a nurse practitioner: they usually work in a partnership with other healthcare providers. If they work in a hospital, they will work alongside nurses and doctors and any other specialists that will help the patient in the best possible way. They order and interpret diagnostic tests for the patients. They diagnose and treat patients with illnesses. They're allowed to write prescriptions. And they're also allowed to make their own decisions, which is probably the most rewarding part of being a nurse practitioner. They are licensed and qualified to make their own decisions for the patients that they're treating. And even though they have to work in a team sometime or under a doctor, they are allowed to make their own decisions whenever they are choosing a patient treatment option. Working conditions: they work in hospitals, clinics, offices, colleges. They can be professors, or they can work in a nursing school to teach further nurses that would like to be nurse practitioners as well. Their work schedules vary. They can work like a 40-hour week, or they can work nights, or they can work weekends, or they can work weird days of the week depending on where they work and what department they're in. They usually work inside. A lot of the places is indoor that needs nurse practitioners. They stand for long periods of time, so they might have feet problems or be sore after their long shift. A nurse practitioner may be physically demanding because of them having to lift and move patients, and it could also be emotionally draining because of the critical health decisions that they have to make when they're dealing with their patient's health. They have to be very attentive to this job because of the diseases and illnesses they come in contact with. They must be aware of the precautions and guidelines. That way they do not get anything that their patient might have if it's contagious. Around 15% of nurse practitioners work independently and own their own practice. In order to become a nurse practitioner, you have to get a bachelor's in science and nursing. This takes about 4 years of full study time, and it will have both classroom time and clinical learning. The second step to becoming a nurse is getting your license to become an RN and passing the NCLEX, which is a state exam. And then after you become an RN, you can become licensed in your state and then obtain your board certification. And then you're allowed to apply to graduate school to become a nurse practitioner, and you get to decide if you want to do a master's or a doctoral degree. Some RNs work a couple of years before applying to graduate school to gain experience in the field. Learning resources, like I just said, during nursing school and before applying to graduate school, you want to gain clinical experience. You want to be experienced before going into graduate school to make yourself as prepared as possible. You want to choose an area of specialization. Different specializations can cause your salary to be higher or lower. Nurse practitioners that work in emergency room make around $120,000, whereas nurse practitioners that work in a doctor's office or a family physician's office make around $98,000. While working and going to school and everything, you'd like to think about your options for your future, what you want to go do, where you want to go to school, kind of have a plan, and you want to apply to multiple schools so that way you have options. You can pick the best thing that is for you and would benefit for you the most. There's a current shortage in nurses, which is why they are allowed to have their own independent practice. The shortage of physicians is giving more power to PAs and NPs. My timeline for the next 5 years starts with me finishing my health degree at USF, and it will be finished by May of 2019. After that, I will graduate with my bachelor's degree and then apply to an accelerated BSN program. I want to get a second degree in nursing. That way I am able to get my RN and apply to a nurse practitioner program later on. In around August of 2019, I should start my nursing program and finish my second degree, which is a bachelor's degree in nursing, by the end of 2021. At the beginning of 2020, I want to gain patient hours by completing clinicals during BSN program. So I will gain hours because I will have to complete clinicals during my BSN program. And after that, I will search for possible job prospects, which is towards the end of the BSN program, just so I have an outlook on what's available and what I need to do, like some things that can make me a better candidate when looking for a job right out of school. In December of 2021 through January of 2022, I need to study for the NCLEX and wait for results. This is a very important test, and it gives you your license as an RN if you pass it. You're allowed to take it 3 times a year. In February of 2022, if I pass my exam, which hopefully I will become a licensed RN and start my first job as a nurse. I really think that I want to work in an emergency room or in the trauma department. In February of 2022 to June of 2023, I want to work in a healthcare setting as an RN to gain experience in the field of nursing. I don't want to go straight from RN to the MSN program or DNP program because I want to have a little bit of experience under my belt before furthering my education. In July of 2023 to December 2023, I should be applying to MSN or DNP programs, getting letters of recommendation, and making sure my resume and application are as strong as possible and make me look a good candidate when the interviewers are looking at me. In January 2024, I hope to begin my MSN or DNP program and be on the way to starting my career goal. Once I graduate the program, I want to find a job close to my hometown. So while I'm in the program, I'll look at hospitals and healthcare settings close to where I'm from, which is Cocoa Beach, to see if I'm available or allowed to find a job close. During your program, you should look for your jobs in area of your interest if you want to specialize. I'm thinking about ER, pediatrics, or oncology. I have volunteered at a cancer center, so oncology is something that I'm thinking of. And then I also want to join Florida Association of Nurse Practitioners.